Levothyroxine under the brand name Synthroid. Today, I'll be going through the adverse or side effects only. Without further ado, let's go. If we don't want either the unpredictable adverse effect or predictable side effects, the best thing that can help us is to run away from known contraindications to Synthroid. Topmost on the list will be hypersensitivity reaction. If the history is telling us that, we have to run away. We don't give Synthroid. I will delve into that deeper in a bit. Also, we will not be comfortable to give Synthroid if there is hypopituitarism. If it is not yet corrected, no Synthroid, because we run into trouble. For example, in hypothalamic pituitary adrenal axis failure, leading to adrenal insufficiency, and the individual is not producing enough glucocorticoids, Synthroid has the capability of clearing glucocorticoids in the system. So, if we administer Synthroid in an individual that is not having enough glucocorticoids, then we will tilt him or her into Addisonian crisis and sudden death. In hyperthyroidism, no need of exogenous thyroid hormone again. In thyrotoxicosis, no more exogenous Synthroid or thyroid hormone. In thyroid storm, no more. In already known or perceived myocardial infarction, myocarditis, or pancreatitis, we will keep Synthroid off the table. Also, in so many other conditions, particularly when on certain medications like methimazole or propyltyrosine, will keep Synthroid off the table. If anyone will ask me, can Synthroid adverse or side effects claim my life? I will say no, but I will not forget to tell you that under certain conditions, it might be yes. No, in the sense that if you have doctor-patient relationship, a good one, your doctor will know when to give you Synthroid, the dose to give you, and when not to. For example, you are an elderly man or woman. You need Synthroid. He or she, your physician, will not give you high dose to start. No. He or she will give you low dose and titrate as you might tolerate or you might require later on. Another instance is if you have hypersensitivity reaction, the history had been there. Your physician might tell you, I'm going to look for another agent entirely, particularly reaction that had led to anaphylaxis in the past. And your physician will tell you that because of your heart disease, because of adrenal insufficiency in you, because of the diabetes mellitus in you, because you have depression and you are on certain antidepressant, because you have history of DVT and you are currently on anticoagulant, the dose of Synthroid that I'm going to give you might not be the exact dose that your neighbors is or are taking, or even your family members. No. Why? Each person will be given Synthroid as it is appropriate, so that Synthroid as a good medication may not end up taking your life. For example, you have adrenal insufficiency you are producing low level of glucocorticoids. But Synthroid has the capability of clearing glucocorticoids in the system. If you are given the same dose of Synthroid like your uncle or neighbor or your roommate with high dose of Synthroid without adrenal insufficiency, you will get down to Addisonian crisis and die suddenly. So, the Synthroid is not the one killing you directly, but the effect of that Synthroid on glucocorticoid clearance has led to your sudden death. So, in that circumstance, your physician will first of all give you glucocorticoids first before giving you Synthroid. Is that not interesting? That is why I'm here. That the good medication can become harmful under certain conditions. In all, Synthroid has less trouble when given appropriately. Let's check some facts quickly. If you know thyrotoxicosis, then you've known Synthroid side effects. If you want to know more about thyrotoxicosis, please kindly go through this link. I have a separate full pieces of information already published. When we are talking about side effects or adverse effects of Synthroid, we'll be talking about thyrotoxicosis. And is that different from hyperthyroidism? Yes, somewhat, slightly. Let's check. Thyrotoxicosis is all about signs and symptoms that are due to the effects of excess thyroid hormones. These could be from the thyroid gland itself, or the ectopic foci, or as a result of exogenous intake, in this case, Synthroid. But hyperthyroidism, on the other hand, is just that the thyroid gland is overactive. And that overactivity has led to excess thyroid hormones production. And that has led to hypermetabolic state or thyrotoxicosis. In the case of hyperthyroidism, it's only about the thyroid gland, either toxic goiter, toxic multinodular goiter, or toxic adenoma. So, in thyrotoxicosis, we'll be dealing with signs and symptoms of excess thyroid hormones. And today, excess thyroid hormones from exogenous intake, Synthroid. Though adverse effects are unpredictable, side effects are predictable, but either case, we have to watch out for the dose. The dose of Synthroid we are given. For how long are we giving this? What are the other possible medications that this individual is placed upon? Meaning drug-drug interaction, right? Then is this individual having comorbid conditions? No, diabetes mellitus, deep vein thrombosis, depression. Okay, then we will likely face some possible side effects. Now, the most important contraindication is hypersensitivity. In hypersensitivity, we can say that levothyroxine is not commonly having hypersensitivity. I mean, hypersensitivity to levothyroxine is uncommon. But hypersensitivity could be as a result of reaction to any component of its formulation. And that is more common than having hypersensitivity to Synthroid itself. In this case, the individual could come down with rashes, pruritus, hives or urticaria. Now, and sometimes it could lead to anaphylaxis with hypotension, swelling, shortness of breath, wheezing, respiratory distress, and so on. In fact, flushing, angioedema, abdominal pain, fever or joint pain all could occur. If Synthroid is ingested in excess dose, either wrongly prescribed or inadvertently taken or maybe intentionally, we then have the chance of running into toxicity. Toxicity of Synthroid will give us diaphoresis, sweating profusely, inability to sleep, in shock, dyspnea, heat intolerance, headache, tremor, becoming nervous. Heart attack is a possibility. They can have diarrhea, heart will be racing, confused, disoriented. In fact, can throw embolism in the brain from atrial fibrillation. Seizures is another possibility in toxicity. Become weak, muscle weakness, coma, and may likely die dead. The heart could suffer when we are on Synthroid on high dosage and for a long time. In that case, there might be arrhythmia, and the commonest one here would be atrial fibrillation. There might be myocardial infarction, otherwise known as heart attack. The left ventricle may become massively enlarged, left ventricular hypertrophy. The heart rate can shoot up, the BP can shoot up, and the individual will become dizzy. In any individual with diabetes mellitus, get it right. If you're on Synthroid for a long time, high dose, you're likely going to come down with worsening diabetes mellitus. Why? It's going to increase the glucose and decrease the effect of the agent you are using to treat the diabetes mellitus. In other words, diabetic patient on Synthroid will need to check the glucose level more frequently, and you may need more of the anti-diabetic agents you are using. But please titrate the glucose level appropriately with Synthroid dose, please. In any individual with deep vein thrombosis, Synthroid has the capability of increasing bleeding tendency. So, watch out. The dose of the anticoagulant might have to be dropped. But this could not just be done as a blind procedure. We have to check the clotting profile and check the thyroid function test also and titrate appropriately. In adrenal insufficiency, we might run into trouble when someone with adrenal insufficiency is on Synthroid. Why that? Synthroid increases the clearance of glucocorticoids. And remember, in hypothalamic pituitary adrenal axis, there will be decreased adrenal function. And if we have increased clearance of the little glucocorticoids produced in adrenal insufficiency, then we will run into Addisonian crisis. What can we do? This patient is having adrenal insufficiency, at the same time having hypothyroidism because of the problem with hypothalamic pituitary thyroid axis. Then we have to give glucocorticoid first and then administer Synthroid. In depression, Synthroid has the capability of increasing the effects of antidepressants. Not all of them, but some of them, like tricyclic antidepressant or tetracyclic antidepressant. Discuss with your psychiatrist, clinical pharmacologist, or pharmacist, please. In any patient that is on antidepressant but is in need of Synthroid, please have that conversation. In gastrointestinal tract and diet, there might be nausea, vomiting, or diarrhea. In fact, increased appetite, but with weight loss. Remember, in hypothyroidism with low level of thyroid hormones, there will be weight gain. Now you are correcting that. Then there will be weight loss. Because Synthroid will increase the level of the thyroid hormone. So it's going to go in the opposite direction to hypothyroidism. In central nervous system, there might be headache, tremor or spasm, nervousness, irritability, acute muscle weakness, even anxiety or inability to sleep. There may be fever because the hypothalamus could be affected and the body temperature regulation impairment. The reproductive system is not spared from possible side effects. Women could come down with irregular menses. Infertility is a probability. Ovarian cysts could be developed. And anyone with pregnancy might be battling with probability of preterm birth. And there's likelihood of increased placental lactogen with probability of gestational diabetes mellitus. Synthroid will stimulate follicular proliferation in the reproductive system. Synthroid is good, but in musculoskeletal system, there are certain facts that we need to know about possible side effects. The bone marrow density will likely drop, decrease bone marrow density, and increase likelihood of osteoporosis. And with that, probability of having fracture will be on the higher side. Height can drop, and particularly in pediatric age group, there might be slip capitofemoral epiphysis. In addition to that, there are rashes, hair loss, sweating profusely, intolerance to heat, and let me also hit on these that hypothyroidism in children will warrant adequate treatment with Synthroid. But overtreatment in pediatric age group will also lead to craniosynostosis if the individual is still growing. So the skull won't be able to develop fully in them. So let's note that also. In respiratory system, there will be increased respiratory drive, dyspnea on exertion. Warning. What I'm doing here is just to prevent disaster, right? The dose when it comes to Synthroid is not fixed. We always have dose range. It is not fixed because we have to titrate the dose of Synthroid with thyroid function test, clinical state, and certain comorbid conditions in the recipients. For example, in elderly, they cannot be given high dose to start. No, we initially going to start with low dose, then titrate up as he or she might be able to tolerate it. At the same time, we will put into consideration all other possible comorbid conditions in him or her, thyroid function test, and the clinical state in him or her. Now, in heart diseases, since Synthroid on its own, high dose for a long time, is capable of giving heart attack, high blood pressure, increased heart rate, arrhythmia, atrial fibrillation. That is a possibility. High dose for a long time. We'll be careful in anyone with heart diseases. In adrenal insufficiency, I've stated it a while ago, right? That Synthroid has the capability of clearing glucocorticoids. In adrenal insufficiency, in an individual who is not producing enough glucocorticoids, and we are now exogenously introducing something that could clear the little glucocorticoids produced, then we'll be sending this individual to a dysonium crisis. And that will be devastating. To prevent that, we must give glucocorticoids ahead of the Synthroid. In hypersensitivity reactions, I've stated clearly before now that Synthroid on its own will not commonly lead to hypersensitivity, but the components of its formulation can likely lead to hypersensitivity. If that is part of the history in these patients today, no Synthroid and no Synthroid ever, particularly if history of anaphylaxis had occurred in the past. No Synthroid again. Still on warnings. In diabetes mellitus, Synthroid will worsen the glucose level, shooting it up, right? Decreasing the effects of antidiabetic agent. Meaning we will likely need more of the antidiabetic agents or insulin. But we cannot just close our eyes to do that. We have to titrate the level of glucose with the level of Synthroid appropriately. When someone is on Synthroid high dose for a long time, then there must be, the close watch on the bone. Why that? Bone marrow density will drop. Osteoporosis will rise. Fracture will increase. Height will drop. In children, when we overtreat, we treat them to another problem, closing the probability of the skull to develop fully. Bleeding tendency, someone is having DVT, is on anticoagulant. Let's note this. Synthroid will increase bleeding tendency, so we have to decrease the dose of anticoagulant. But we cannot do that closing our eyes. Clotting profile should be done. Clinical state of the affected person should be done. Titrate the level of the Synthroid appropriately under those circumstances. Someone is on antidepressant. Synthroid will likely increase the effects of tricyclic antidepressant and tetracyclic antidepressant. Great, right? Discuss with your pharmacist, clinical pharmacologist, psychiatrist. In mesodermal coma, Synthroid is not given per oral. It must be given intravenously if we want the individual out of the coma back to life. With that, I come to the end of this short presentation on possible adverse and side effects of Synthroid. Synthroid is a good medication, no doubt. But in medicine, everything must be done appropriately, carefully, with all precautions taken. Thanks for listening. Remember to share this. You are free to drop your comment. I appreciate it.